unprecedented situation. This virus doesn't discriminate. It attacks everyone.
The number of cases worldwide rose past 1 million. The virus is being blamed for more than 59,000 deaths.
ימים מורכבים וקשים עבור החברה הישראלית.
שממשיכים לטפל במסירות רבה בלתי נלאית. אני מודה לכם בשם העם כולו.
Thank you. Welcome to another webinar by Technion Australia. It is good evening if you're in Australia, good afternoon if you're in Israel. My name is Ori Danieli. I'm the Executive Director of Technion Australia. Those of you who are not familiar with Technion, it's Israel's Institute of Technology and among the world's leading dedicated to science, technology, and engineering. So we bring you once again the opportunity to have a glimpse into the world of our scientists, or as in this case, to the world of our alumni who are now industry leaders. I want to start by acknowledging our event partners today, the Australian Friends of Rambam, and we see Vered on the screen here, Vered Arhel, who we'll hear from in a little while. Technion in Australia specifically is part of a worldwide association, a worldwide network of associations with a mission to support the Technion by fostering research collaboration and encouraging philanthropic support for research, infrastructure, and scholarships. As we can all appreciate, COVID-19 has completely changed our world. It changed more than anything how we interact and how we socialize and behave in public and so on. It affects everyone, whether you're young, old, poor, wealthy. There's really no difference here. And I think one of the key elements here that kind of strikes me is that there's a lot of information out there, and there's a lot of uncertainty and inconsistency, or even a small example is looking at Israel, where putting the Israeli viewers today would obviously be familiar with it. Putting a mask is like one of the major things that you need to be doing during these times to protect yourselves and the people around you. Where here, where we're based in Australia, it's barely even a recommendation, so putting a mask. So that will be some of the things that we're very lucky to have Dr. Yael Shachor Meyouhas with us today, who lives and breathes this epidemic, and will be able to share some of her insight into how Israel is dealing with this case, perhaps answer some of our questions about the uncertainties, and equally as important, give us some advice on what Australia should or could be doing to perhaps not follow in the same path. On that note, I am going to hand over to my colleague Vered Arhel, who is the Executive Director at the Friends of Rambam in Australia, to say a few words and to formally introduce our moderator today. Just sorry, Vered, I forgot. Just one note before I miss out. As with all our webinars, you're all very encouraged to ask questions and participate. So you're welcome to use the Q&A section or the chat section on the Zoom, as well as the comment section on Facebook. We're live on Facebook as well, and Yael will do her best to answer given the time allocated. So Vered, over to you. Thank you.
Thank you, and good evening, everyone. On behalf of the board of the Australian Friends of Rambam, I would like to thank you, Ori, and Technion Australia for partnering with us for the first time. Rambam Healthcare Campus is a 1,000-bed world-class teaching hospital based in Haifa. The patient population is diverse. as Rambam is the major referral medical center for all northern Israel, serving more than 2 million residents and other referred from all over Israel, the Mediterranean region, and around the world. Rambam is respected internationally for its clinical services and innovation in medical technology. Now, there is a tight medical research collaboration and synergy between Rambam and Technion Israel, and both entities have just recently announced the establishment of a joint research fund to support the development of new therapies and technologies in human health. Now, Australian Friends of Rambam was established to support Rambam Healthcare Campus to the Australian community, and we also facilitate research collaboration between Rambam Healthcare Campus and Australian medical research institutions. Now, the other important part of our activities here, conducted through our Circle of Health program, which has the important goal of helping to improve health in our own community. We do this by conducting a range of health and wellness activities, by utilizing local expertise, and also using experts based on the Rambam. Now, our program includes various educational seminars, such as Meet the Expert and practical activities. Now, tonight's webinar is a very relevant, as us in Victoria is going into lockdown again. So the topic is COVID-19, are we prepared for a second wave? And I would like to introduce our moderator, Warren Bingham, Chairman of MedTech International, a leading medical consultancy. Warren was one of the global executives who introduced PillCam to the world, and specifically to Australia. PillCam, which is the world's first video camera in a pill that you swallow, is a Technion invention and regarded among Israel's most successful medical device inventions. The company in 14 years went from startup in year 2000 to being sold in 2014 for nearly $1 billion. Warren will formally introduce our speaker and moderate the conversation. So Warren, back to you.
Thanks very much, Fareed. Can you all hear me? I believe you.
We can hear you, but I can't see you.
You can hear me, but you can't see me. All right. So I'm, whilst I'm doing this, there's
can you see Warren?
No.
No, you can't.
No,
you can't see me. So look, I'm just re-logging back in. So give me 2 seconds, and whilst I do that, I will. The wonders of technology, huh? Here we go. I'm not quite sure what happened here, but good evening, everybody. And you've got me now?
Yes.
Fantastic. So, well, it's wonderful to be here, and a great welcome to everybody, and thank you for all who've joined us, and thank you, Fareed, for that lovely introduction. I'm not going to waste a lot of time because we have a very lovely guest, Yael Shachor, who is joining us this evening. Yael, you bring to us this evening your expertise as an infectious disease expert. You're the Deputy Director of the Rambam Health Campus. You were the former Deputy Director of Pediatrics at the Rambam Health Campus. And you work where you sit above the world's largest underground hospital, which we've just seen a video on. So as Fareed has said, we have entered into the space of the discussions of second wave, whatever that means. And also, as Victoria goes into lockdown, I note that yesterday there were some major changes in Israel as of Monday, your time, where very similar occurrences are going on as we speak. So Yael, it's wonderful to have you here, and we look forward to the conversation. And I'll hand over to you, and welcome.
Okay, thank you very much. It's nice to meet you all, although I can't see you all, but I would like to share our experience during these days, and the question whether we are in a second wave or not. Just for a few moments, I would like to, just a minute. Okay, just a few slides, and I think what I would really like is to answer your questions and hear from you if some of you have an experience, and I think that would be better than just talking, but I really wanted to point out a few points. In the beginning of the epidemic, we were called by the Ministry of Health to give solution for COVID-19. And it's more like 4-phase solution. And in short, the first phase was when we had just a few patients and we had to give them a place, and we chose the negative pressure isolation room in the beginning. And even these days, it's not very, we're not sure about the real transmission of the virus, although we know better than in the beginning. In the beginning, it was thought that it's very, very contagious, not just in when we touch, what we call contact precautions, but also aerosol, like diseases that you know, tuberculosis and measles, that are very contagious through the air. Now we know that it's not so usually with most of the patients. We have some exceptions, like patients who need oxygen supplementation, etc. So this was in the beginning. Next, we have the phase 2, what we have called the Crohn department, as Corona is the Crohn, with 30 patients and 6 ICU beds. And the next stage, which we think we are approaching, I hope not, because as of today, we have almost 20 patients. And I have to say that after the first wave, for 2 weeks, we didn't have any patient at all. So now we are definitely in something. Some of the people can call it the second wave. Some call it the continuation of the first one. So I don't think it really matters, as long as we know that we have many patients now. So the phase 3 is more departments. And of course, as you were mentioned, we have the opportunity, as we have the largest underground hospital in Israel. It is known in the whole world, and we can adjust it to 900 patients with 300 ICU patients. And the thought is for patients all over the north of Israel, maybe even more, if we will need this place, especially in the winter. It's your winter now, but we are approaching the summer, so we have a few months. But in a few months from now, we know that the winter is not an easy season in Israel. We have a short supply of beds, of ICU beds, and we are concerned. As you can see, this is a screen of our team. We meet every day for half an hour, to deal with the situation and to know when we are approaching, if there are things that we should do in many, if it's the security or the buildings or the internal world. So everybody are involved in this situation, and I think it is very important to involve all the key person in the hospital, in the community. Even if it's a community, I think that many people and key with all the stuff that I mentioned should be involved, and it's important them to add some information that sometimes we can miss when we don't ask all the people that are involved. I just wanted to show that in the beginning we had the help of many, if we're talking about the Technion, and we had some great collaboration from the industry and places that are not usually deal with health. And I think Australia can do that as well. If you are approaching a situation when you don't know what to do, sometimes other industries and places that are not dealing with health can give you a different point of view, and they can help you dealing with this situation. And I think it was amazing to see the contribution of all those places. Now, about the corona situation, this is as of July the 4th. So today we have some more patients and unfortunately more death. But you all know the situation in the world. You all know the situation in the States. And I think the situation in the US, in Brazil, in Italy, in Spain in the beginning, and the UK, we have learned many things about the preparation, about the preparedness of the health system, about the dealing with the more weak population and people that I think it is a lesson that I personally take for the future, but I think we all should think about as a lesson, not just for the health system, but for other, for the community and some of the weak population that were very, very vulnerable and from all those, from the coronavirus. This is the situation in the world. So you have to, I think when you read the data, as Ori mentioned, it's a bit confusing, and I have to say that with the new situation, you can see and hear some views that are changing over time. You mentioned the mask, and in Israel, in the beginning of the epidemics, we, and including me, said that the masks are not helping us as something to do with the whole population. We need them in hospital, we need them when we treat patients, and even the WHO, I think, still holds this thought. But when, as the time came and we saw so many cases, I think that the mask can help us in some situation, and maybe I will talk about it later, a bit more practice tips when the mask and gloves and alcohol gel can help us. So this is the situation in the world. I guess you know better than I the situation in Australia, and I saw that you have a very, very nice and helpful site to learn about the cases in Victoria and in other places. And I think as we see in the whole world, when we see crowded places, cities, we talked yesterday about New York, which is a very crowded place, and Israel also is a very crowded country. So it's very hard to contain mini outbreaks or the beginning of outbreaks in those crowded places. And when I look at the Australia map, and I agree that if you asked me a few days ago, then I guess someone could have told you that something is going on here. So you see that you have, you are amazing, yes, 8,000 cases, and so it's very few cases for this big country, but now you can see that something is going on. And I think in the beginning there are many differences between the first wave and the second, and I don't think it's relevant, and if it's interested we can talk about it later. But one of the differences is that in the beginning of the epidemic, the first wave, most of the cases, and even in Israel, were exports from other countries. So we had the privilege to know whether someone came back from, let's say, Italy, Spain, China, whatever, he's high risk. And now, during the time, and of course, in the second wave, it's irrelevant because there are almost no flights, and those who come are only Israeli citizens, and I know that Australia are doing the same. So most of the cases are cases from the country, and the export are less relevant, and it's very hard to predict because we don't know who is going to have the disease or be contagious. Okay, this is something that also from yesterday was a concern, but today I've heard that you are going to, in Victoria, lockdown. In Israel yesterday, we also had some others. We came back to some of the situation when we were. It includes weddings, only 50 people, and not closing bars and other places that just were open 2 weeks ago, 3 weeks ago. So this is the situation in Israel. And you can see very good the second wave. And again, we can call it a second wave, or we can say that here we were all at homes, not going out, and oops, we were out, and this is the effect of us getting out. And we can say that this is the first wave. You can see why so many people in Israel are very concerned, because this is the first peak and this is the second, and we have many cases, but most of the cases are not severe. Most of the cases are young. In the first wave, we had many elderly people, and now we have young people. Usually they are not very sick, but I think that if we continue to do what we did, then even the elderly, and we will go back to the first situation. One or more slides, you can see that the cases in Israel, I mentioned here the intubated, the very ill patient, they're not changed. You can see that it's about 30 patients, but the severe cases are going up with 90 cases comparing to 40, and the mild cases are way up. Those are the most cases. I think that you have seen in many sites the recommendation or some of the risks that you can see, and I agree that the lowest risk is going to walk around or doing some exercise, being alone at the park or at the road, and of course the highest risk is bars and gyms and large music concerts, etc. It's the same. And the last slide that I want to share with you is in the first wave, when we were all locked down and just went to work. So my husband didn't go to work, and he was at home with our 4 kids for almost 4 to 6 weeks. And he's a photographer, not just as a hobby. And he came to the hospital and took some photos. And you can see the site, and he shared some of the experience of someone who came from outside to the hospital, to the corona ward, and I think it's very interesting. And for me, it was an opportunity for him to see me in all the work and the busy days that were endless. Okay, so this is something that I wanted to share with you, and I think we'll go through the questions, or Warren, if you want me to share some of our experience. We can't hear you, Warren.
Sorry, that's because I'm on mute. Now I'll get all this technology. You think I'd have it all sorted. Thank you so much, Yael. Look, one of the things that I think we sometimes suffer from being here in Australia is, and particularly with the low number that we have, as you said, if you look at comparisons, as we discussed the other night, we are 3 times your population, and yet we have 1/3 of the contracted cases. Although the death rate's very similar in that context. Now, I guess one of the challenges that brings to the Australian population is actually believing whether or not COVID is real. And quite often, and there is quite a large proportion of people out there questioning, was this a conspiracy? Is this really real? What's your perspective on that?
Okay, I'm not on mute. I think we have to be humble with a new virus, and whether it's a corona or a new flu virus, and I don't know if some of you remember the H1N1 in 2009, and of course there is the SARS and Ebola. So whenever we deal with a new virus, I think there are some points that we have to think about. First of all, every new virus is new. So most of the population didn't meet this virus and can get sick. Most of the new viruses, or let's say when the flu is changing, not to a different virus, we won't feel the illness. But this is a virus that can cause illness. It can cause, many of the population will have sore throat, maybe a fever, and maybe even will contract it and go unnoticed. But some of the population will have a severe disease. And we saw it in the beginning of the outbreak. And I have to mention the H1N1 in 2009, although it didn't get to this so many cases, but we had, even in Israel, and I know and I remember from the States and from Australia, many severe cases in children, high mortality, and it wasn't just flu, even the H1N1. So for those who are saying that the coronavirus is just the flu and don't be panic, I must say that we have to be patient and wait for the next year to see whether it acts like a regular flu. Maybe in 2 years or the next year, we will see that the coronavirus, after the whole population will know that this virus, we'll see that it's just the flu, like the flu, and some of the patients are very sick and some are not. But now the numbers are different. It's not just the flu. In Israel, every year, about 80 people die from flu. And let's add some patient that we don't know, we don't check, but we don't approach 300, more than 300 from the flu. So there is the component of the severity of the virus that we don't know for sure. We can say just what we know for until now. And there is the component of the new virus that I'm sure that adds to the situation. So maybe, I'm sorry, this is an announcement from the hospital that everybody should wear masks and use hand hygiene. And so so you will hear the Arabic version and the Israeli version. And it's very hard because this is, I think, the opportunity to say that not all the people in Israel are very compliant.
But it's real.
Okay. So I think it's a complex situation, but it's not just the flu. This is the top message.
Right. And what about the impact of mental health in Israel? You have now over, I think, 300 deaths and some 30-odd thousand plus confirmed cases. So what have you seen, and what's been the experience in Israel from a mental health perspective?
I think it's a very good question, because when you are going, there are many aspects. I think in the beginning there were fear, and people were very frightened, very afraid of the virus, of the impact. The elderly population in particular were announced as a population at risk. So those who are 65 and going to work felt uncomfortable, because those who are not working were advised to stay home. So I think that there was stress. There was also, and now we see the impact of depression and anxiety, since almost 1 million people were without a job, and now we are going back to a situation like this. So there were many people that were anxious. Now we see a bit rise. I'm trying to be careful, because it's just the beginning, but we see a rise in suicide attempts. We see elderly patients that some of the physicians will use the word pushed to dementia, to Alzheimer, patients that are elderly, and for 2 months they stayed at home with no relatives to contact them, with some difficulties, and I think that it's just the tip of the ice. And I have a feeling that in the next few months we will have to deal with some of those problems that we are now trying to approach. I have to say that many volunteers in Israel did so many good things, like doing Zoom contacts with the elderly population, giving foods. Even in the hospital, we were trying to support some of the patients that stayed at home with telemedicine that was rising, and it was very, very good to see this opportunity, because we had some difficulties doing telemedicine. And we also try to support the staff and the staff that treating the coronavirus patients, because in the beginning, I don't know whether you had this situation, but the families were not allowed to come and visit their relatives, and people died, and the funeral was with just a few relatives, and it was very, very hard for those patients and families.
Certainly sounds like a number of very strong similarities that we've experienced in both countries. In putting the infectious hat on, if you will, the infectious disease expertise hat on for a minute, is COVID-19, is it easily spread through the wind, in the wind? When we start looking at particles, moisture particles coming from one human body to the other. And this also goes into the question about the value and the purpose and the benefit of wearing masks. We in Australia do not have a mask wearing culture yet. Whether we do we evolve into that space will be interesting. We have in Victoria major lockdowns going down in several suburbs, but also in several high-rise high density housing facilities or areas. And I've not seen that they've been instructed, other than the security and the police who were there to cordon off the area. I don't believe we've initiated a mask wearing requirement. So what's your thoughts on the importance of a mask? Does it benefit the wearer versus someone other than the wearer? Are they effective? Could you share your perspective on that?
Yes. I will go back with the mask to other diseases. When we have patients with the flu or with other viruses, we as the staff members should approach them with wearing masks. And I'm not getting into the N95 or because most of the diseases, as we call them droplet, not airborne. Droplet means when the size of the drops is big enough to fall into the ground after 1 meter. We go further for 2 meters just to take to feel more secure. And the airborne is very, very contagious through air. So with the coronavirus, in the beginning, there was a thought that it is an airborne and it's very contagious through air. And it means that when I go to some place or at the same house, almost 100% of the family are being infected. And we see that in the coronavirus, it's not the issue. So it's contagious through 2 ways, and I think this is one of the strongest points of this virus. First is the ability to contract it through air, not very contagious, but if I sneeze or if I cough and we are talking, then the air droplets can come to you and you can be infected. The second way is I can't say even more important, but it's not less important, is the contact. And the contact with some of the virus is very important. And let's say, for an example, that I have to sneeze or I'm coughing and I'm doing it on my head like this, and then I meet you, Warren, not through the Zoom, and I shake your hands and how are you? And then after I shake your hand, you have something in your eyes or you want to take something through your mouth. This is an easy way for the virus to be very, very contagious. And when we, in meetings and we eat together and I take the spoon and you give me something to my plate, this is an easy way, much easier than just coughing. So in this way, even if I'm even if I'm wearing a mask, I can infect everyone because I have something in my mouth and I give you a hand and so etc. etc. So I think that the mask can help us when we are very crowded and someone is sneezing or coughing or just breathing on us. And if he does it through the mask, then of course it's great. And if everybody wear a mask, then of course we have less, the opportunities for infection are less. But I think that the contact is very, very important. And you can see that I have here on my table an alcohol gel, and I take it with me in a small bottle, and me and my kids and all the families and everyone that I advise, we use it when we do things. And I'm glad that you didn't ask me about the gloves, because in Israel, in the beginning of the epidemic, everyone were using gloves. And glove is terrible. If I take the glove just, to go to the supermarket and touch something and do, or take the garbage downstairs, then it's okay. But if I wear gloves and I think that I'm protected, I'm doing everything that I did with my hand, just with gloves. I touch my phone and my eye, and so this is something that I do not recommend. But the glove, I think, the mask, I think that when I go to crowded place, it gives us some protection. And I don't know about Australia, but maybe in a few weeks ago, your government will recommend. It's something that, it's up to their health ministry of the Ministry of Health of each country.
Fantastic. Yeah, we're getting lots of really good questions coming through, which is great, and many of them are very much in line with the conversation we're having right now. One of them is, what is the life duration of the virus on the skin or on the surface? Do we know how long the virus can survive in an environment, given the fact that environments are different all over the place? But what's the medical and scientific perspective on that?
Okay, this is also a very good question, and I think that we're getting many data over the time. So something that I can say now, maybe it's irrelevant in a few weeks, but in the studies that were conducted, we can see that it depends. Of course, it depends on the amount of the virus. If I sneeze, it's a lot of virus, or if I touch without sneezing, it's different. So first, the amount of the virus. Second, what is the surface? Some surfaces, the virus can stay much longer if they smooth or plastic or Nerosta, or so the virus can stay. We heard from a few hours to a few days. I think that as we see that most of the people got the disease from close contact. So I will say it again. Maybe I will go to the bus and half an hour ago there was someone with corona. I can say that if he touched after sneezing and I touch and I put the hand in my mouth, then there is a chance to get the disease from this situation, but it's very rare. If I clean my hands, try not to touch my mouth, my eyes, and sometimes use alcohol cleaners just to clean the environment, but not very excessively. I think it's safe, and we don't have to panic. In the beginning of the epidemic, I was doing many Zooms with parents, with many people, and I think that we have to be reasonable. We want to go on and living our lives, but doing it in a safe way, but reasonable.
So that's potentially going to change the culture, or could change the culture of Israel, right? I mean, Israelis, from my experience, love to hug. They're very emotionally happy, very welcoming people, and I don't think I've ever been to Israel and not said hello with the customary Israeli hug. So, how are you guys coping with all of that?
First of all, I think you should come to Israel. We'll be happy to host you. And
I might have to swim. I don't think I can fly right now.
Yeah. Okay. After, in a few months. Yes, I thought that in the first wave that maybe we are going to we're going through a cultural change, but I have to tell you that we're not. And when most of the people had the opportunity, they came back hugging. That's why we have the second wave so quickly. They came back hugging, and some of the people have changed some of the waves, but it's a culture that I think it will be very hard to change. Although I taught my kids how to hug their grandmother, it's a new hug.
How did you do that?
No, it's not it's not a health advice, so I'm not. But I have to stress, if we know that that the virus is in our mouth, then we don't have to kiss and we don't have to touch, but we can do something that is, you know, something that is more safe, and we don't have to touch. I'm telling them, don't touch grandma's phone if you don't clean your hands, and don't touch it. But if you want to touch, put an alcohol gel before, and don't switch so many things, because in the beginning they didn't see. I saw that there was a question about meeting the grandparents, and in the beginning of the epidemics, I think that the grandparents were, it was sad, because there was an advice not to visit, and I understand, because there were people at risk. And now, even it was allowed, I told my children that they have to be safe, and they don't have to, you know, run and do it in a safe way. And if to prefer going out to the garden, not being in a small place with air condition or heat, in your case, going out to the air, be 2 meters apart. This is something that is safe, and we can also enjoy the company.
So another question we had, and it's all obviously related, but it talks about elderly people, and apart from confinement and total isolation being a way to move forward and live with this, what are some of the practical elements? You've mentioned that for your kids when they visit your parents to make sure they wash their hands and so forth, but do you have a particular mantra as to, or some advice on the most practical things to do no matter where you are and what you're doing and who you are in regards to trying to prevent contracting this virus?
Okay, so I think it depends on the situation. As I mentioned before, when we had so many cases, I advised my parents not to go to the supermarket if they have the opportunity, that someone else will bring them all the products and everything they need, and to stay home, you know, as long as they can do it, and to be in contact through Zoom, and just the necessary thing to do. And when the situation was almost back to normal, because it's not normal, so my kids, of course, visit them again. But we are trying to do it safely, not running and hugging through the face. And to sleep at my mother's house, so she had the separate bedroom, and I told her, you remember, she's only 10, but you remember not doing, because you know, it's not like in the past. We can't close our eyes and say it's like in the past. So I think that the most important things is really not being so close as we can, using alcohol gel. I think alcohol gel and of course water and soap if the hands are dirty. It's very, very safe and very, very important. Not coming to visit elderly people if we have fever, cough, and we don't feel very good. Of course, this is very, very important, because it can be, of course, a disaster for everyone, but for those who are at risk.
So the title for this discussion, which we're discussing, was "Are we prepared for a second wave of COVID-19?" With the developments that are occurring in Israel right now, do you think there's a risk that the situation in a second wave could be worse than a first wave? And additional to that, do you think the government may have to lock down the entire country rather than just piecemeal strategies or geographical locations?
I think now we are in a situation, the corona here, and I think it will stay with us for a few months. And we have to understand it. If we approach the winter and we have the flu and other viruses and we have a problem, maybe we will have a problem. As for now, I think our health system is dealing with the situation. We don't have so many very, very severe cases, and we don't have so many intubated patients, and we can deal with the situation. And I think the economic impact was so hard that we have to take it into account. So now, when the situation is getting worse, I agree that it's reasonable to lock down some of some places that have many cases and test more, or to doing less or wedding with less participants, because this is a time when we have to go back to some of those steps that we did in the past. A completely lockdown, you know, it's a political decision, but I think that seeing the situation and the health system that can contain those patients, I think it would cause an economic damage that I'm not sure that, you know, and I have to say another word about the missing cases, or the cases that were not coming to the hospital and the clinics during the first wave. And I think it was terrible because many patients were so afraid and they didn't come to seek medical advice. And now we're dealing with problems that could be easier if we deal with them in the when they were just in the beginning. So this is another view of the lockdown, that we can miss many other cases, cancer patient, diabetes patient, and many patients, depression. So I think we have to see the corona effect, but we also, as a health system, I'm not talking about the economic at all, as a health system, we have to see other health problems and how we are going to approach them and deal with them. And I think the health system in Israel can do it, can do both. So I hope the situation will be better. And of course, I hope in Australia that you will stay with your low cases, and this is something that will go through. And
so two more questions, just two more final questions. Thanks, Yael. One is, what do you think the time frame and the expectations might be in regards to a vaccine or vaccines?
Okay, I know. I think the information is shared through the news and media, and I think many companies are working about the vaccine, and but it will take time. And you are in the winter, so and we are approaching the winter, and I don't see a vaccine coming before the winter. But I think it's important because even if the corona will be part of the other viruses, as I believe for the flu, I think a vaccine is very, very important. And I hope I have to say something about drugs. And I think maybe it will be with the vaccine. There will be a vaccine and we will think it's great and we don't know. With the drugs, we also see a pendulum that some drug is the best and the next day it's the worst. So as I said, we have to be humble and patient and to study from the cases from the world and everybody.
Yael, my final question is, so is Israel ready for a second wave?
I think we are more ready for the second wave than we were in the first. I think we have to understand it's not like the first wave. There are many differences, but I think that we have a great health system with staff, people that are amazing, all the staff, and I think we can be ready for the second wave. And of course, if there in the future, if there will be more questions and you want to transfer, and I'll try to help and answer and share our knowledge because we don't have enough time for all the questions.
Absolutely. Well, look, toda rabah, Yael. It's I'm not going to say goodbye to you just yet, because I know that Ori and Vered would probably want to say a few final words, but it's been a great conversation. We do have many other very, very good questions that unfortunately we didn't get time to. So Ori, maybe I'll let you talk to how you might wish to handle that. And perhaps I'll hand back to you and Vered.
All right, thank you very much.
Sorry.
No, that's okay. Thank you, Warren. Thank you, Yael. That was really interesting. I'm sure we can keep going for another hour easily. There are a lot of questions that we didn't get around to, and if, with your permission, Yael, I might send you an email, and when you have a moment to give some answers, and we can share it later on our newsletter. That would be really helpful. On this note, I wanted to thank you, Yael, for your time. I'm sure that you're very busy, particularly nowadays. And Warren for giving up your time and helping out, and we appreciate that. And of course, our partners, Vered, which I'll let say a few words in a second as well. I just want to encourage you all to please follow us on the social media to keep up to date with events and other opportunities. Usually when we finish our events, we invite people to come and visit the Technion, and in this case, Rambam as well. But of course, there's restrictions, but we hope that at some point, we can have you over to visit in Israel, and similarly have the Israelis and Yael, who I understand never been to Australia, to come and visit us here. Finally, just wanted to invite you to an event that we're hosting, a webinar that we're hosting next week on the 16th of July with one of Technion's Nobel Prize laureates, with Professor Aaron Chichanover, who is actually the first Israeli to be awarded with a Nobel Prize in science. And he will be talking about the future of medicine, Israel's unique entrepreneurial culture, and his journey to winning a Nobel Prize. So hopefully you can join us. We'll send you an email about that. Ellie too are very welcome. Finally, when we sign out, you will receive a very quick survey. Literally, it wouldn't take you more than 30 seconds to answer, but just give us a little bit of direction of what topics you'd want us to cover and some feedback on today's event. So just before we sign off, I'm going to hand off to Vered to say some final words. Again, thank you all very much. Take care. Vered.
Okay, thank you again, Ori and Technion Australia, and thank you, Dr. Yael Shachor Meyouhas and Warren for a little bit of more insight about the COVID. And we would like also to invite you to join our first series of event, Meet the Experts. Now we're going to start on the topic, the prostate cancer, and we're going to discuss in various available treatments that offered by Rambam. And this event is going to be on the 20th of August. Another event about men health and mental health is going to be on the 6th of August with Rod Buttress. I don't know who of you that knows Rod was the president of St Kilda Football Club. And we also invite you to join us and to go on ozforam.org.au, I just sent it, and in social media, Australian Friends of Rambam. So again, please be safe, those in Victoria.
Thank you very
Absolutely.
much.
And in Israel.
Be safe and hope that everything will be okay.
תודה רבה, יעל.
Good health.
All right.
Thank you.
Tודה.
Good day.
Thank you. Good night,
Bye,
everyone.
everyone.
Take
All
care,
the best.
everybody. Bye.
Bye.
Bye bye.
Bye-bye.